High Court has suspended a government order to prevent those who are not fully vaccinated against COVID-19 from accessing services and entering public places such as hotels, bars, restaurants, national parks and wildlife reserves in November. Health Minister Mutahi Kagwe announced all residents would have to show proof of vaccination by December 21st to be able to access all public services in person. Now, on Tuesday, however, the High Court Judge Anthony Mrima suspended the order pending a hearing of the case filed by businessmen who termed the directive tyrannical and a gross violation of the Constitution. For more on this, I'm joined now by court reporter with the Star newspaper in Kenya, Anette Wambula. Annette, good to have you with us tonight here on In Focus. What's the stance of Kenya on vaccine mandates?
Yeah, so the Kenyan government, of course, issued a directive late last month about people accessing government services and other services would need to have a vaccination certificate to show that they have been vaccinated. And basically what the government said at the time was they wanted to hit a target of around 10 million Kenyans by the end of the year who had been vaccinated. And that's why they issued the directive. But of course, as you have rightly said, a businessman moved to court to challenge the directive and basically said the move and the directive by the government were sort of illegal. And he termed it as the government forcing Kenyans to make a decision that they don't want, and it is the right of every Kenyan to choose whether they want to be vaccinated or not. So there is that standoff where human rights, of course, and majority of Kenyans, as you know, right now it's less than 10% of Kenyans who have been vaccinated. So people are still on the edge, and they were feeling like the government is trying to force them to go and vaccinate.
Yeah. What are the factors that lead to such a low vaccination coverage?
I would say people are a bit skeptical. There are a lot of myths, of course. People are just on the fence. There are a lot of misconceptions, there are a lot of truths and untruths about the vaccine. Some say, and also about religious beliefs. So there are so many factors that are making the percentage of those who are vaccinated to be very low, because it's still very low, less than 10%. Yeah. So around 2.6 million Kenyans have been fully vaccinated as we speak today.
Human Rights Watch is
arguing, which is very low.
All right. Human Rights Watch is arguing that this new policy that aims to persuade people to receive vaccines would actually fail because Kenya does not have a sufficient supply of COVID-19 vaccines actually to ensure that all adults are vaccinated.
Yeah, that's also what human rights activists have been saying. But the Minister of Health has insisted that they have around maybe 10 million. And they're expecting maybe more to be brought. So they want at least to reach the 10 million mark, because right now we are still at the 2-point-something million, which is very low. So they want to hit that target. They wanted to hit that target before the court stopped the directive by end of this year. So the directive was supposed to take effect from Tuesday next week. Yeah. Now with the court order, that means it will not take effect.
Now, of course, that's still being challenged in court, but should the government be successful in this new policy, these new measures could leave millions of Kenyans unable to get essential government services. Have they been given alternatives as to what they would need to do? I mean, for example, those who would have medical exemptions and so on and so forth. How will this be enforced?
It's still a very tricky situation and a catch-22 one, because the Minister of Health said they will advise those who are not vaccinated to use digital platforms. But as you know, we are not fully digital. Most of the government facilities you need in person, and that is what the government was saying. If you don't have a valid certificate, you can't get in person. And it's not only about government services. They were talking about restaurants, they were talking about public transport. So it was going to affect millions of Kenyans, not necessarily, even if you don't want services, you need to use public transport, you need to go to a hotel, you need to go to entertainment places, which they were saying you cannot go to. And even hospitals, they were saying you can't go to a hospital if you're not vaccinated. So those are some of the challenges and the things that Kenyans were saying. I mean, that was overreaching of the government.
Yeah. What do we know about this businessman who's brought this court challenge?
According to the court documents, he's a businessman. He's called Enoch Aura. He basically filed the matter in his affidavit. He says he's a businessman who just wants to fight for Kenyans like him who are still apprehensive about the vaccine, because in one of his quotes and his affidavit, he swears and says that the government is lying to Kenyans about the vaccine and not coming out clean to say exactly the symptoms that people will have, the side effects basically that they would have. He's also accusing the government of going into an agreement with international pharmaceutical companies to sell vaccines so that they force Kenyans to take the jab. So he has really accused the government and just told them that it will be a futility to try and force Kenyans to go and get vaccinated when they don't want to, because it's their right to know their health. And he's also comparing Kenya to Israel, and he's saying in one of the points that our country will reach a point and be like Israel, where right now they are giving several booster shots and not just the 2 jabs that the government is telling Kenyans. So they're saying for them, they're still very skeptical. They want to watch and see before they are forced to take the jab. Yeah.
What type of vaccine is currently being administered in Kenya?
There are several. There's Janssen, which is Johnson. There's AstraZeneca. There's Moderna too. So there are several that are being administered, not just one.
Yeah. So does the businessman in his papers indicate that he doesn't believe that vaccinations should be included in the broader public health strategy of Kenya?
He basically says they are skeptical. They are saying for those who want to get vaccinated, they can, but they should not force and give measures that would bring a challenge to their livelihood and their day-to-day lives. So they are saying basically most of them are just apprehensive, and so I would say he does not believe that the jab is genuine, the jabs that we have, because he's saying the Ministry of Health has not told them, him included, the side effects they might get. So they are worried that once they take the shot, then they might have adverse side effects. And those are the things that he's saying he's concerned about. Yeah.
I mean, in your view, is there evidence to support that? Is there a lack of public health education in Kenya about the vaccines and how they would impact and the side effects, and how they would actually be administered and how they would react in your body?
I think for me, I would differ a bit and say, of course, the Ministry of Health has been going out, giving leaflets, because as we speak right now, they have upped the difference. They have put up several places where people can get vaccinated, at bus stops, at hospitals, near offices. So when you go there and you get a nurse, they will explain to you if you are a bit scared or afraid of the jab. So I think the government has that, but I think they can do more, because maybe people in the village, in the remote areas, are not really aware, because some of them I saw on TV, some of them have not been reached to, and they don't even know that there are jabs being given.
Anette, we appreciate your time and thank you very much for joining us tonight here on In Focus. Court reporter in Kenya there, Anette Wambula, with us tonight.